Are we ready?
Thank you, Madam Chairman.
I do want to say that this is the first Senate bill that we've heard, so you're the very first. So,
Well, I'm honored, and I know, especially this time of the year, that's quite an honor based upon the multitude of other things that we all have in our committees to try to get out before the cross on that. So I do appreciate that. And if I may, I've got a little handout for each of you.
Eric will help you press those out, I think.
Thank you, Eric. Madam Chairman, I'm certainly prepared to present this bill whatever level of detail that you'd like, because it is very important that everybody understands the details. But if for some reason I do take more time than you'd like, don't hesitate to ask me to conclude. Maybe about 5 minutes here I'd like to share if that's appropriate.
That's fine. We'd love to hear it.
Senate Bill 442 is a big step forward in protecting the lives of our children. Our child abuse laws in Georgia today is currently weak in 3 areas, and I'm proposing changes to address those deficiencies. The primary revision in the legislation before you deals with the urgency in reporting suspected child abuse. Today, if a teacher or a nurse believes that a child has been abused, they must report their suspicion as soon as possible. That's how the current law reads, as soon as possible. This may be interpreted by some to mean a few hours, or by others it may mean actually a few days, or hopefully not, even a few weeks. On page 1, line 23, we simply remove the phrase as soon as possible and replace it with language requiring that an oral report must be made within 24 hours after there is suspicion of child abuse. This report can be made by calling 911 if for any reason it cannot be made within that 24-hour period. There's been some concern about the deadline, but if a person who is responsible for reporting child abuse, like a teacher or a nurse, is unable to present that concern through their required reporting channels, and they're supposed to have channels on how they're supposed to do that. Let's say it's Christmas Eve, and they try to do what they're supposed to do based upon their policy. And let's say it's the 23rd hour, and they have to report it. They can simply pick up 911 and be absolved of any liability if they, thank you, if they simply pick up the phone and call 911. This change eliminates the vagueness that exists today when it's necessary to report child abuse, and it's a primary revision to the legislation that's before you. The second revision that I'm suggesting deals with the accuracy of the very first report of suspected child abuse. We've added language on page 1, beginning on line 17, that states that no one can change the initial report of suspected child abuse. Other people can add additional facts that are relevant to the situation, but no one can alter the content submitted in the initial report by a teacher, a nurse, or anyone else that's responsible for reporting child abuse. This legislation does not change anything about who is responsible for reporting the abuse. It just states that the initial report must be included as is, and it must be passed along to the appropriate authorities without any editing. The final change addressed in this legislation deals with courtroom evidence. Current law states that a photo of a child's injury should not, let me repeat, should not reveal their identity. But in some courtrooms, photos without faces have not been allowed as evidence. Excuse me. When this law first passed a number of years ago, this language was meant to protect the child's identity from the public. This is no longer necessary since both Georgia and federal law have been changed since then, and the child's identity in these kinds of trials today is now protected. Consequently, lines 13 through 15 on page 2 need to be deleted. In closing, I'd like to draw your attention to the handout on your desks. On it, you will find a long list of associations that support this legislation. It includes the groups that represent teachers, hospitals, and the child advocates that are required to report suspected child abuse. They want this legislation, and I'm asking you to join us with your favorable support today. And I would like to add that the legislation did pass out of the Senate without any opposition. Thank you again, Madam Chairman, for allowing me to present this bill to your committee today, and I will yield for any questions that you may have.
Are there questions from members of the committee? Anybody got a question for Senator Moody? I have a couple that I'd like to ask. You said, I believe, that a person could call 911 to report child abuse. What happens when you do use that facility? I mean, what does the 911 guy, how does he handle the call? He doesn't dispatch or anything? I mean,
Madam Chairman, I believe the real reason that is in there is to absolve the reporter from any liability. It shows that they have done what they're supposed to within that 24-hour period. And I think it really depends on the particular issue. If it is, I think discretion is really what we're trying to do here. If it's clear that there's an emergency there, and I would like to think that if there were a true emergency, that the person that's responsible would not have waited till the 23rd hour to call 911. That they would have done that immediately if there's an issue. But I think it really depends on the situation, and I would expect that discretion would be applied on the part of the person that works at 911. The reason that's in there, and the reason I brought it up, is because of the liability issue. There's been concern that someone could be held liable if they don't report it within 24 hours, and this is just simply to allow that person not to be held liable. It just demonstrates that they're doing their job. In many cases, we would continue to work the normal reporting system if it's a non-urgent system or a non-urgent situation. If it is an urgent or an emergency, I would expect that 911 individual to call in the appropriate authorities to deal with it at their discretion.
Okay. Representative Ash?
Now that you've given me time, Madam Chairman, to read it, I do have a question. What happens if they don't do this? Is there a penalty? Is there?
Thank you, Representative Ash. There is a penalty. There's a misdemeanor charge, and that's exactly why we put this opt-out opportunity.
Got it.
If they've tried to use their normal reporting process and they're unable to fulfill that process, this absolves them of that liability if they simply pick up the phone and call 911.
Good question. Representative Tucker.
Senator, I'd like to thank you for this piece of legislation. And, it's very much needed. You know, I do have some concerns about, since I work in that field, sometimes we can put so much pressure on people when discipline comes, but it's a difference between discipline and abuse. And I find myself sometimes wondering, just because parents or whatever would discipline a child, and especially where I was brought up, you would have certain marks on you as the results of discipline. You know what I mean? When Willie got a spanking, it wasn't a spanking, it was something that everybody else could tell.
Your mama made you pick a switch, is
That's
what
right.
she did.
And sometimes when kids go to school, and I have found this to be, and I have to instruct my officers to be very careful, because, you know, when teachers see this, or whomever, they are afraid not to do it, and it causes a lot of other work. You see what I mean? Because what they'll do is immediately pick up the phone and call, and we have to go out, and then you bring parents in, and parents are kind of scared to discipline their children. But I do applaud you for this piece of legislation. But also that should be taken under consideration. So mainly my conversation is not to ask you a question, but to congratulate you on this, and I support this. But I do want all of us as lawmakers to be aware. During drafting of things, we should be aware of this, because sometimes it does tie to parents' hands. You know what I mean? I have a lot of parents coming in, and the kids tell them, you can't do anything about it. And I know if this was coming on during my days of being brought up, my parents probably would still be in jail if they were alive. You know, you understand why I'm coming from.
Yes, I do, Mr. Vice Chairman, and I think that's a very valid concern. And like yourself, I know when I misbehaved, our generation was quickly brought back into alignment, and I think people are concerned about that more today than they were when we were raised. The legislation does require that, as you know, reasonable cause has to be determined, and it's not just that very first time that somebody is suspected. The whole issue of reasonable cause has to be established before the clock starts running, and I hope that people will continue to use common sense, and only until that reasonable cause is determined does the 24-hour clock start to run. But certainly I agree with you, Senator. We don't, or Mr. Vice Chairman, we don't want to use this to all of a sudden increase the level of reported child abuse. It's only where there's a reasonable cause, and we want to make sure that we eliminate this vagueness, as you well know, as soon as possible is inappropriate in this day and age when we all have the ability to communicate very quickly to somebody else when it's necessary to do so.
Okay. Are there other committee members with any questions? I do want to ask, would you like to respond? Oh, I'm sorry.
I just wanted to...
Representative Neal.
Thank you, Madam Chair. Just wanted to say, after 21 years of ministry and 15 years working in the school system and being around a lot of children that need protection, that I applaud you as well. And I know none of us like to be in that position to where we are faced with that decision or that choice of having to make that report. None of us want to be there because of the things that it brings to the family. But in the day that we live, obviously it's a part of our society. It's something that we can't hide from. And I appreciate you in this bill making it a little bit more obvious what the responsibilities are, and protecting those children from the people who would possibly alter a report or fail to get that report in time. And I applaud you. And Madam Chair, I would be willing to make a motion at the appropriate time.
Let me ask, the Child Advocacy Office is in the audience. Would you like to make a comment, Dee? Or you don't have to, but if you'd like to, I certainly want to recognize you and thank you for coming.
You got the
Thank you,
votes.
Madam Chair, members of the committee. I would like to tell you just a brief, a little bit about what the Office of Child Advocate is doing in conjunction with support of this bill. We have a mandated reporting training project that has been going on, and it is aimed specifically at the schools. We have used it with the health department in a number of localities, but it helps to not only define the responsibilities of a mandated reporter, but we focus on indicators of child abuse and neglect. We focus on things that they might see in the school system, helping them to make informed and seasoned decisions so that we don't have an escalation in the number of reports that don't need to be investigated. So we really are focusing on that, and we have a coordinated effort with a number of agencies, including Prevent Child Abuse Georgia. We're also looking at the current time at doing something with the early care learning environment, so that we're focusing on those that take care care of our children in the daycares, because the indicators are somewhat different with that population than what we might see in elementary, middle school, and high school. So we're aware of the increase that might occur. We are very focused on that and trying to do a lot of education. In fact, in a couple of weeks, I'm headed over to the social workers convention over in Jekyll to do a training with them so that they will be better informed about what we are doing and what they need to be looking for.
Thank you, Dee, so much for what you do for our kids. Thank you so much. Are there other questions? Okay, I'll entertain a motion. Representative Neal.
Madam Chair, I move that the committee pass Senate Bill 442 with a do pass recommendation.
Second.
Second. All in favor, say aye. Are there any opposed? Congratulations, Senator. We're delighted to have had you, and we appreciate the legislation so very much. I do think it's one of those bills that even though we hate to have it, it's a good thing to have. So thank you so much for bringing that forward for us.
Thank you, Madam Chairman and members of the committee. I just would be remiss if I didn't point out that bills like this require a tremendous amount of work long before they reach the General Assembly.
Absolutely.
And the Office of the Child Advocate, especially Allison Anderson, to end up with a bill that has the support of the hospitals and the teachers and everybody else. We all recognize how much work goes on behind the scenes before we actually introduce these bills, and I'd just like to publicly thank them for all of that blood, sweat, and tears.
I know I thought Allison lived in my office for a period of time there. Thank you very much, and we appreciate the Senator coming and bringing that forward for us. And those of you in the audience that need to be excused are excused, but you might not want to be, because we're going to hear from Mark Trail from the Department of Community Health about Katie Beckett. So we're looking forward to that. Mark?
Madam Chair, members of the board, members of the committee, appreciate the opportunity to come and address you, and I want to use your time to its best advantage. And however, I don't want to presume that the committee may know what's been occurring. I know some of you may, but I wanted to maybe spend just a few seconds talking about that, why we are where we are today, and then some of the most recent events that have been occurring around the Katie Beckett program. First of all, the Katie Beckett program, as it's referred to, is actually an eligibility or an aid category within Medicaid. Some have referred to it as the Katie Beckett waiver. It's not actually a waiver. It's an official aid category within Medicaid. It was established back in the mid-1980s at the congressional level, an amendment to the Social Security Act. Presently, there are 20 states that have opted to include, this is an optional aid category, there are 20 states that have opted to include this optional aid category in their Medicaid program, of course, Georgia being one. It's a very varied number of folks engaged in the program across the country. We were able to check several of the states within the Southeast and found that actually Georgia had by and far the largest number of children enrolled in the Katie Beckett aid category as about a year and a half ago. Of course, that has changed, and that's why we're here to talk about that a little bit today. One of the other things that's been occurring with Medicaid in general is we're looking very carefully. I know for those of you who've been involved in the budget committee hearings and the budget process that you've heard about the fact that even though the economy has improved here in this state, eligibility continues to grow. I think we've anticipated a 5-point-some decimal number growth, continued growth in our low-income aid categories. We suspect that that's a result of the fact that even though there are more jobs, many of those jobs are lower-paying jobs as opposed to higher-paying jobs. So as a result, people continue to come onto our rolls, even though typically we would have seen them gone down as the economy improved. As a result, what we're doing is making sure that all those who are on Medicaid indeed do belong on Medicaid by whatever type of eligibility they enter. So, for example, we are doing income verification now. Previously, it was self-attestation. Come in, I say what my income is, and we would accept that. There was some some checking behind the scenes, but it was not particularly vigilant. And now we're actually requiring that folks come with 4 weeks of pay stubs to represent what their income is. Another example is we're requiring that for undocumented aliens who present for emergency Medicaid, they are eligible for emergencies. Before, we used simply the doctor's attestation that it was an emergency. Now we're actually reviewing those with our prospective review organizations, Georgia Medical Care Foundation, I'll use their reference again in a moment, and assuring that, in fact, the care that was provided that Medicaid would cover was indeed an emergent care, was an emergency situation. In the Katie Beckett program, as a part of this overall initiative in ensuring that folks are indeed eligible for Medicaid, the Katie Beckett program has certain requirements. Some of those are at a high level, may be fairly obvious. For example, the child has to be under the age of 18. They do have to have a disability. But in addition to that, the child also has to meet institutional level of care. In other words, were it not for services being provided to them in the community, those normally they would have been provided in an institution for that child. Now, the important thing to understand about that is that with that additional criteria, you actually have to meet a higher standard or level of care than you would, say, to be on SSI disability. Now, normally these children would have been on SSI disability, except for the fact that their family income was too high. So the additional standard that was put in the Social Security Act back in the mid-'80s was that, okay, we will overlook income of the family if they meet this institutional level of care. In Georgia, every state has some difference in the levels of care, but in Georgia, we have 3 institutional levels of care: hospital, skilled nursing, and intermediate care for people with mental retardation. Those are the 3 institutional levels of care that are available in this state. So now what we are doing, now our prospective review organization, if I could use their initials, GMCF, Georgia Medical Care Foundation, they are a subcontractor to our MIS vendor, the one that adjudicates our claims. They do the medical review for us. They've done it actually under direct contract for a number of years, but now are a subcontractor to ACS. They do the medical review. The applications, the individual who's going to apply, the family that's going to apply for their child, goes to the DFACS office, fills out applications, and then there's some clinical information that they have to gather and send into GMCF. GMCF has nurses and doctors that do the reviews and determine whether that child, based on that information, meets institutional level of care. Now, they have some processes that they go through. You may have heard over the past year, particularly back around in summer and fall, that it was taking a long time to get the evaluations done. That was true. We did have to modify our contract with them to add some more staff. That was done in June. They are now caught up. In other words, they are doing the evaluations within a timely fashion based on our expectations for them. They do have 2 medical directors. I know there was some concern early on about the medical director that was overseeing this project within Georgia Medical Care Foundation. We did, through contract negotiations with them, change those medical directors. We now have a pediatrician and a pediatric neurologist who are the co-medical directors. And then they also they have under contract other peer specialists for particular specialities, say a pulmonologist to help, say, with a child who has cystic fibrosis, for example, that they can send those records out for review. So they do have those folks under contract. The result has been, we were up to about 6,500 children on the Katie Beckett program, kind of at its peak. That was towards the early part of last calendar year. The result has been, between new applications and those that do reapply, they have to do that each year. We have to affirm the level of care each year. That probably in the neighborhood, I believe the last numbers I saw, about 1,700 applications. Those, again, were new and renewals. I think about 1,100 of them were renewals. have been denied. Now, that's a lot of kids that had been approved before. One of the things that I need to point out for the committee is the fact that before, when the institutional level of care was supposedly applied before, the problem is that level of care, because the department had not specifically developed and instructed Georgia Medical Care Foundation to apply a pediatric level of care or pediatric assessment to that level of care. They were using the level of care that they had, which was essentially an adult level of care review. So they would look at something like a diagnosis. Okay, yes, they have a diagnosis. Second, they would look at, do they have a treatment plan? Yes, they have a treatment plan. Then the critical factor was the third factor, and that was their functional status, we refer to them sometimes as adult daily living skills or ADLs. Those skills, are they present or not? Well, we're talking about children, children with disabilities. So I don't know that they ever denied a case under those kind of criteria. And that really, so the absence of age-appropriate criteria what was resulting in the fact that everybody got approved. And when we had discussions about a year or so ago about the Katie Beckett program in particular, we got a number of reports. You may recall you saw last year, I believe, a proposal to have premiums for some of the higher-end families in terms of income. And as that was being debated and discussed, we, of course, received a number of anecdote reports that, you know what you need to do is not that. What you need to do is focus on the fact that you got a lot of kids on here that really don't belong on the Katie Beckett program. So all those factors came together. We developed age-appropriate criteria, and we are where we are today. I will tell you that something that we've also done, in fact, just last week, we have published some further definitions on the ICF-MR criteria, which we believe will actually make it a little more inclusive rather than exclusive. And one other piece of information that I will share with the committee is that I got an email actually this past Friday from CMS, the federal government that oversees us with the Medicaid program. Catherine Casserell, I'll be happy to leave I apologize, I just have one copy, but I'll be happy to leave it with you, Madam Chair, where CMS asked us to, because they were getting calls as well, and they said, we'd like to review some of the cases that you reviewed. So we selected a dozen closed. In other words, they had gone fully through, there was no pending appeals or anything like that, fully through the denial process, randomly selected 12 cases, and sent them to CMS for review. Catherine Casserell sent me an email on Friday and indicated that CMS is in agreement that the 12 cases you shared as examples were indeed correctly terminated, and then goes on to talk about, she had some questions about whether we would seek federal funding for, I believe there's some money included in the 06 budget to help address some of the needs of some of the children that formerly were on the Katie Beckett program, but now were going to be removed from that program. And they expressed some concern that we not seek federal funding because they didn't know of any program under which we could do that. But I think that effort has taken its course and is I believe, going to occur over in the Department of Human Resources, and they're going to set up a mechanism so that they can generate some more funds and hopefully serve some of these children with their ongoing needs that do not qualify for the Katie Beckett program. I hope that's not more than you wanted to hear, but I did want to make sure that I know that some of the committee's members I have not spoken to before and may not be up to speed on what's going on.
Members of the committee, questions? Representative Ash.
Help me with those numbers again. A year ago, 2 years ago, how many children received a Katie Beckett waiver?
At its peak, we were up to about 6,500 children.
And how many now receive that waiver?
We're at the last count, and I believe it was December, there is some lag in us actually knowing the numbers, was about 5,200.
And that difference has to do with the change in the criteria that the review panel is looking at to determine if they're eligible or not?
Yes, ma'am.
When the parents originally applied, were they given a set of criteria that would be used to evaluate if their child was eligible?
Prior to the change?
Yes.
Yes, ma'am.
And when the change occurred, were they given the new standards to which they were going to be held?
Yes, ma'am. They were published on our website. We had a couple of public meetings. We tried as best we could to get them out in a number of different ways.
And help me understand again why it was necessary to move from one set to another set. Pediatric, I mean, are they appropriate for kids? Why were we ever doing it wrong to begin with?
It's difficult for me to say why we were doing it wrong from the beginning. I will tell you that this program's been in existence in Georgia at least since the late 80s. Much before my time. I'm not copping out on you. I'm just telling you that that's the way it's been managed for a number of years. I will tell you also that since 2000, we only had about 2,500 children on the Katie Beckett program. So there was a substantial growth, in fact, almost a tripling of the number of children from 2000 to 2004. What has raised all of this to a new level of importance to make certain that Georgia's Medicaid program is evaluating eligibility in all aid categories, not just this one, but in all aid categories. The federal government is going to begin some very specific audits. It's a payment error rate measurement audit system, PERM, it's also referred to. You may hear that expression. Begins for Georgia in January of 2007. They will be auditing federal fiscal year 2006, so in other words, the time period that we are in right now. There are three primary elements to those audits. They will be extensive audits. They've hired auditors specifically for Georgia to begin this effort, as well as other states as well. Those PERM audits will look, they basically will start, the end measure is did you pay what you should have paid? The way they're going to start that is they start back at eligibility. It's not just an evaluation of did your claim adjudicate right through the system and was it an approved code, did you pay the right price, and was it an enrolled provider. All of those are part of it, but that's sort of the end part of the stream. The beginning part of the stream is, was the member eligible in the first place? Did they meet the income? Do they meet the disability criteria or the institutional level of care criteria, or whatever the criteria is for the particular aid group? And they'll be doing the eligibility, they'll be doing the scope and covered benefits, and then they'll be checking the pricing as well. Will all be part of those audits.
How many auditors are coming to Georgia to do that?
I'm not sure of the whole number. I know they've hired 2 in the Atlanta office specifically, and then they've engaged a private contractor to participate in this audit, so I don't know the total numbers.
And one final question. Tell me what, as a state, we're doing for the families and the children who are deemed by your department to be ineligible.
There are a number of things. One, most specifically, the legislature is adding some money to the 2006 budget. I apologize, I don't know the exact number. I think it was like
It's about $7 million.
$7 million, I believe. And that will be running through the Department of Human Resources to provide some measure of benefit. I'm sure there's still some detail to be worked out in terms of what it will cover, but in the discussions I've participated in, it will be things like services that are not otherwise covered by another government program, or say their insurance or something like that. So, for example, it might be co-pays or deductibles. It might be and again, I'm emphasizing might because they've got to write the policies for this, but it might be also uncovered services. 71% of the children on the Katie Beckett program have other insurance, actually. But for the therapies, for example, most commercial plans do have a limit on the annual number of therapies that they'll cover. So there may be other therapies or additional units of therapy that a child might need that hopefully this allocation could help them to address.
I'm sorry, I can't resist. And so will the
Does anybody else have a question?
So will the Department of Human Resources have a different set of eligibility standards for kids who used to be Katie Beckett? I mean, and is the $7 million an annual appropriation, or is this a one-time shot?
I think I can speak to that. It's supposed to be a one-time shot, and what it's supposed to do is supposed to clean up the errors that we've made in eligibility over the years. What has happened is these roles have gotten to the point that they're totally unmanageable, and there are lots of kids that are on the Katie Beckett currently that really never qualified. They didn't meet any of the criteria really, except that they had a child with a disability. And so even if it was a minor disability and they needed just a few therapies, they would still be entitled to the Katie Beckett. So this is an effort not to just throw those kids to the wind, but rather to phase them out over the next year and a half. And then to go ahead and create other waivers. Am I right, Mark, that we're going to be seeing some other waivers brought forward from the department and others in order to make sure that when kids need some therapies and so forth, that they can at least apply for some assistance in receiving those services.
I believe that is correct. I understand that there is some specific language about who this would apply to, this $7 million would apply to. I think it's also anticipated that it's not just one-time money, but that it's seed money to hopefully perpetuate through some other resources additional money to make this an ongoing thing, so it won't be just a one-time thing. Because there are people who, these children, for example, who kind of fall in between the cracks. If I could, you've got the SSI disability group, so anybody who meets that threshold, both in terms of their diagnosis and in their family income, will get on Medicaid automatically. Then you've got up here this standard of, okay, they have the disability, but they have to meet institutional level of care, so anybody above this gets on Medicaid. So it's this group in between that does not, and I think that's what this allocation, this seed money allocation, is intended to try to address. And again, hopefully, we'll certainly be working with DHR to try to make that go as far as it can go, and hopefully on an ongoing basis.
Representative Thomas, you got a question?
Yes, I do. Good morning. I have a couple of questions. The first one is it possible that there were some families or some children who were taken off of Katie Beckett that should not have been when the change came?
We don't think so. Every family does have actually at least 2 levels of appeal. We've always had, although it's not required, we've always had the opportunity, basically the family gets a letter of initial denial. If the Georgia Medical Care doesn't believe that they meet institutional level of care, they give them an initial denial letter, and they're informed that if you provide us additional information, and they try to specify what it is that specifically causes them to not meet institutional level of care, they can provide additional information. Then, based on that additional, and some cases are, in fact, approved then after additional information is provided. But after that opportunity has occurred, then they're given a final denial letter, and in that final denial letter, as well as the initial, they have the opportunity then to ask for a hearing. And the hearing process, of course, is the independent review committee. It's through OSA, the Office of States Administrative Hearings, I think is what it stands for. It is an independent administrative law judge, hears all the facts, and then makes some judgment from there. I will say that for all of those that have gone through those hearing processes, none have been turned over. in terms of the decision that the department had made through its contractor. There have been a few, fewer than a half a dozen, that the administrative law judge has turned back to the department and said, we'd like for the doctor to review something in particular in the file, and I believe all but one of those was upheld. One of them, the doc said, yeah, okay, if we look at it this way, then we see that the child would indeed meet. So we have not experienced examples of where a child should not, or should have been approved and has not been.
Okay, my second question is, what do we do with individual cases? I imagine that we all have gotten some communication from constituents who were taken off of the program, and I certainly heard from one in particular who's very frustrated and talked about, I guess, being in that middle group that didn't have access to other services, and so his income did not allow him to be able to provide those services for his child. So what's out there for us to help our constituents when we have these kinds of concerns? What can we do to help them? Where do we send them?
Well, there are a couple of things. Number one, many of these children would be eligible for services through their schools. Now, I understand as soon as I say that, the school folks say, wait a minute, don't send them all to us, you know. But it is, in fact, a fact that these children, because of their disabilities, would, in all likelihood, qualify for special education and services through the schools. It's one possibility. I think the most important answer at this juncture is to acknowledge the fact that there is this $7 million. There really was not an appropriate government program for this in-between group before, but with this appropriation, as that program develops, and hopefully it will develop very soon. I know folks are working diligently to get a program sort of on the street quickly, if you will, to begin addressing those needs, will be another place. That will be operated through the Department of Human Resources. And I'm certain as soon as that door, if you will, to go through is developed, that it will be identified to folks and we'll be able to communicate that.
And you think the $7 million is adequate?
I think the $7 million is a great start. It is an allocation probably sufficient for the first 12 months. You know how I hate to use the phrase, but if you build it, they will come. I mean, when you do create a program, it's very possible that it could create a woodwork effect and more folks would come, and then it wouldn't be enough for 12 months. But for those that we know that fell in that in-between group, we believe that that would be an appropriate allocation.
Thank you, Mark. Are there other questions, quick ones? I know that others have other committee meetings that they need to get to, and this room may kick us out, but I would like to ask, and those of you that do need to go ahead for 10 o'clock, please do. But Mark, I'd like to ask you, do you know what kind of program that might be coming from the department? Because, you know, my phone is ringing literally off the hook about these children that are getting denied access to the Katie Beckett. So there's got to be some other program that's administered, even if we have the $7 million. I mean, you know, they're not going to get Katie Beckett. So what are we going to do?
Well, again, I do think that what are we going to do that other than point them to existing government programs? And the truth of the matter is there's not a lot of government-funded programs for people who are in between these two levels. I mean,
and a lot of those kids are not school age that we're
correct.
Talking about.
There is actually a requirement in the Individualized Education Act idea that addresses children under the age of 3. Schools are to pick children up at age 3, but under the age of 3, we have here in Georgia the Babies Can't Wait program. And of course, you know, they, as everyone else, has a certain limitation on their resources. But that program is a federally required program. It is the kind of preschool arm of the Free and Appropriate Education Act for children school age.
Okay, Representative Ash.
The school piece of this, it's a great way to talk about it. The reality is it's real hard to do. How do you get, if you're one of these parents, how do you get a school to do what IDEA requires?
I want to hear you answer that.
Yeah, I was going to say it might be a question above my pay grade, so to speak. But honestly, I think, number one, that most schools do recognize their responsibilities to provide free and appropriate education. And I think they work very diligently from the interactions that I've had to accomplish that. They do have limitations on their resources. We do actually in Medicaid, for those that are Medicaid eligible, try to provide additional federal funding to help them do that. Of course, that does not help those that are not Medicaid eligible, but it certainly supplements their coffers in a way then that they can serve more kids and expand the services they provide. I think that probably the answer to that question is maybe that's a good question for some of the advocacy groups. Our experience has been that about 90+%, it's in the mid 90% range of all the children that are on Katie Beckett already have an IEP or an individualized education plan or an IFSP, individualized family service plan, which is the plan for under the age of 3. And it is up in the mid 90% range. Certainly advocacy is a route to take. I suspect that it's probably more unusual nowadays that a school would not recognize their responsibility in providing services to the kids.
And does any of this change in the proposed federal reauthorization of IDEA? I know they're going through all sorts of discussions in Washington about what IDEA is going to look like because of what schools are saying are the impossible implications of trying to do it.
I will confess that I don't know the intricacies of that. We're kind of busy studying the Budget Deficit Reconciliation Act right now to see what they did to Medicaid, so I'm certain the Department of Education could.
Okay, well, we thank you very much, Mark, and we'll look forward to it. You've been very, very informative, and we appreciate your willingness to come and share with us about Katie Beckett, and we look forward to seeing what the department's going to be able to do about what we're going to do in the future for those kids that seem to be, falling through the crack. I know that the $7 million is not enough, but it's a lot better than we had in the beginning, and I know I serve and need to go to appropriations right now, but we continue to, like you say, build it and they will come. But the problem, I think, is that the assessment that is made for each child really needs to follow that child. And if improvement is ever going to be made, I think, families ought to have in their planning something that can tell you, this is going to be something you're going to have, and you're going to have to make appropriate, plans for it, or this is something that we can do something about. I know there are lots of tests that we now are putting in with the newborn screenings that will identify some of these issues, and we can do something about the 29 that we're currently trying to get for the babies. So we appreciate your willingness to come before the committee, and I appreciate your time, and look forward to working with you in the future.
Thank you,
always.
Madam Chair.
Okay, I'll entertain a motion to adjourn. Wait a minute. The committee needs to identify a time when we can go to Christian City. We have been asked to come to Christian City, load the mini, and we need to make that arrangement. So look at your schedules and see if you have a day that we perhaps are off, or another day that might be convenient for you. I think Talmadge has identified Monday, March the 20th as a possibility. We need to have at least half of the committee to be able to attend it, just because they're making the arrangements to do that. So please call Talmadge, and also ask your colleagues that are on the committee to identify that date as well. We're going to try to get them to respond to it as well. But get up a group. It will be a wonderful day. It will be something that will be very informative. We're looking at going ahead and leaving the Capitol about 9 o'clock and returning by noon. So that's what we're looking at, and it will be well worth your time and effort, I believe, to visit Christian City. Now, I'll entertain a motion to adjourn. Second. Okay, we are adjourned. Thank you very much for coming.